admit I'm young, I'm strong, I can work hard all night long. I need some money in my pocket. You snooze, you lose, no time to pay your dues. I'm moving up just like a rocket. I can't waste no time in bed, 'cause I can sleep when I'm dead. I got big old fish to fry, so step aside as I cruise by. It's a waste of time, I'm feeling bad.
Hello, I'm Jim Harms, President of the International Association of Fire Chiefs for 2006-2007. I am pleased to present this new project on sleep deprivation, which is a cooperative effort between the Department of Homeland Security, the United States Fire Administration, and the International Association of Fire Chiefs. We are interested in studying fatigue and the effects of sleep deprivation in the fire service because they have a health and safety impact on both fire and emergency services personnel as well as the communities that they serve. This training CD and the accompanying report offer you some educational tools and practical solutions to better manage your own schedule and performance both on and off the job.
Hello, my name is Diane Elliott.
And I'm Carrie Keel. We are practicing physicians and faculty members at Oregon Health and Science University in Portland, Oregon. For the last year, we have worked with the International Association of Fire Chiefs to review information on sleep deprivation and develop a review document and this educational DVD.
We come to this project because for the last decade we've been working with firefighters in Portland and other sites across North America, developing, implementing, and assessing health promotion programs for firefighters.
In this DVD, we will present key points about the physiology of sleep, the effects of sleep deprivation, and strategies to cope with long work hours. You will also hear from other experts on sleep medicine.
If you haven't already done the self-assessment questions that accompany this DVD, please take a few minutes to complete them. It will help you remember the information, and we will present the answers at the end of this 40-minute DVD.
And you do not need to take notes because all the information we present is in the document Sleep Deprivation in Firefighters and EMS Responders, available from the International Association of Fire Chiefs. In addition to working with firefighters the past 2 decades, we teach doctors in training and are well aware of the adverse effects of sleep deprivation in the medical profession.
20 years ago, there was a prominent case of a young woman who died in a teaching hospital, and it threw a spotlight on the long work hours of interns and residents and resulted in many years of debate about the effects of long work hours.
Some argue that the long hours compromised patient safety and also were detrimental to the health of these doctors. But a careful prospective study was done at one of the teaching hospitals in the United States in Boston, comparing the usual long hours to a shorter shift on work performance. Despite being young, healthy physicians who knew their performance was being assessed, those on the long work hour schedule made 5 times more errors than those on the short schedule.
And interns driving home after a 24-hour shift were twice as likely to crash their cars, despite most living close to their work. Car crashes are clearly linked to sleep deprivation, even when drivers do not feel tired.
With that evidence in hand, work hours for interns and residents were restructured. The transportation industry, that is trucking, shipping, and air transport, also has set limits on work schedules. So what are the effects of sleep deprivation? Before answering that, let's review normal sleep physiology. The average adult needs 7 to 8 hours of sleep every night. Infants and children require more sleep. As a nation, we are sleeping less and working longer hours than other Western countries. Sleep has 2 major types: non-rapid eye movement, or non-REM sleep, which is about 75% of our sleep time, and rapid eye movement, or REM sleep, which comprises 25% of our sleep time. Non-REM sleep has 4 stages. However, when we are awake and alert, our brain waves have low voltage, random, and fast waves. The first 2 stages of non-REM sleep have a little bit wider, deeper waves, and then you can see when we are in deep sleep, stages 3 and 4, our brain waves are called delta waves, which are very wide, deep and long. The deeper stages of non-REM sleep are when heart rate slows, blood pressure is reduced, and hormones responsible for tissue repair are secreted. If you wake up from a deep sleep, it takes time to become alert and you experience sleep inertia or grogginess. After non-REM sleep comes rapid eye movement, which is when you dream. REM sleep is when emotions are processed and memories are formed. During REM sleep, your brain waves look like you are awake, but you lose muscle tone, so you don't act out your dreams. This graph shows the stages of sleep. REM sleep is in blue and non-REM sleep is in yellow. Each sleep cycle lasts about 90 minutes, including REM and non-REM, and these repeat 4 to 5 times in a night. You can see the non-REM sleep lasts about an hour and 15 minutes, and you can see stage 4 sleep. REM sleep is about 15 minutes, thus making the 90-minute cycle. Do all animals sleep? Yes, they do. In fact, whales sleep about 5 hours in a 24-hour period. Lions sleep 14 hours, and bats sleep 20 out of the 24 hours. In fact, everybody sleeps, even salamanders, bees, butterflies. Even the well-known primitive invertebrate sea hare needs sleep, which I'm sure you know what kind of animal this is. Circadian rhythms, or another name for that is our natural 24-hour biological alarm clock, is what regulates our days and nights. Humans are day creatures. We are designed to be awake in the day and sleep at night. Even if you are well rested, your alertness is less at night. Jet lag is an example of our circadian rhythm. Going east to west is easier than west to east. A fascinating study looked at visiting baseball teams, and they lost 63% of the games going west to east and only 56% of the games going east to west. So what are the effects of sleep deprivation? What I'd like to do is show a video by Dr. Powell on the immediate effects of sleep deprivation.
What we have learned about sleepiness is somewhat surprising. A very small amount of sleep debt or sleep loss can make a person dangerous. We looked at patients who we deprived of sleep over 1 week, 2 hours a night, and we kept one group up just 24 hours. And then we got one group drunk. And we compared the sleepy patients with the group that got drunk, and they essentially had the same performance. The sleepy people acted just like the drunk people on the driving course.
So the immediate effects of sleep deprivation are, number 1, you get sleepy. Number 2, you have reduced psychomotor vigilance or the ability to stay alert. Number 3, your performance is not stable. Number 4, you make errors. And number 5, your thinking is impaired. Really, you lose the ability to sense how sleepy you are. So what are the chronic effects of sleep deprivation? We're now going to watch a short video by Dr. Dement.
One of the biggest problems in our society is that almost everyone has no awareness of exactly how sleep deprivation works. All lost sleep, and that is the sleep you obtain on a daily basis less than your daily requirement, accumulates as a debt, thus sleep debt. That debt accumulates inexorably day after day. You almost never pay back the sleep debt. And so all of the people who have this sleep loss, sleep debt, who are working in jobs where they are not allowed to get enough sleep, have a risk. They have this monkey on their back that's going to seize them Literally at any moment, drowsiness is red alert. And the bigger the debt, the more likely you are to fall asleep, the more likely you are to fall asleep behind the wheel.
Chronic sleep deprivation has been associated with irritability, depression, and a reduced sense of well-being. There are other serious physical effects of sleep deprivation. You've heard that an apple a day keeps the doctor away. Well, likewise, sleep is extremely important and will keep the doctor away. Sleep is like a nutrient that our bodies need to be healthy. What happens when we are sleep deprived? 3 problems are increased among firefighters and EMS responders: musculoskeletal injuries, heart disease, and cancer. And these are also among the adverse health consequences of sleep deprivation. Firefighters and EMS responders are at increased risk for the exact types of health problems associated with sleep deprivation. This graph shows injuries among different occupations, and firefighters have 8 times the incidence of injuries as private industry. Heart disease is the leading cause of death fighting fires. This recent New England Journal of Medicine article shows on-the-job heart attacks are highest among firefighters. Cancer rates are also increased among first responders due to exposures. In this meta-analysis on firefighters, cancer risk was increased for certain cancer types. Injuries, heart disease, and cancer are all problems that have been related to sleep deprivation. This slide shows injury rates and sleep deprivation. All studies consistently show that injuries are greater later in a shift, with longer shifts, and during night shifts. Auto crashes are clearly linked to drowsy driving. 1/3 of sleep-related crash drivers said they were not aware they were fatigued prior to the crash. Sleep deprivation increases risk for heart disease and cancer. Even adjusting for other risk factors, less sleep increases the risk of heart disease. And we know that deep sleep is needed for cardiovascular repair and to reduce inflammation. In fact, averaging less than 6 hours of sleep per night is comparable to smoking a pack of cigarettes per day. And in one sleep deprivation study, immune system was lowered, and in another study, it increased the risk for cancer. Sleep deprivation is linked to weight gain and obesity. 6 large studies have associated lack of sleep with weight gain. And lack of sleep produces the hormonal changes that promote hunger and weight gain. Let's now hear from an expert on this link of sleep deprivation and obesity.
If you always are in a state of sleep debt, cutting your sleep maybe by as little as an hour per night, you're going to be a little bit more hungry and eat a little bit more. This is a major problem in this country, particularly since we have an epidemic of obesity. Let's remember that sleep deprivation is unique to the human. There is no animal that tries to sleep deprive itself. They just sleep what they need to sleep. We are totally unique in this desire to overcome our sleepiness and stay awake no matter what, even if our body is screaming to go to bed.
So what is known about sleep deprivation, specifically among firefighters and EMS responders? Studies of the effects of sleep deprivation all can be challenged due to differences among groups studied and the potential of other influences. I want to re-emphasize this point, that for many professions, including firefighting and EMS, the unique characteristics and demands of a particular work setting make generalizations about sleep deprivation and fatigue difficult. Work hours are highly variable among firefighters and EMS responders. Many firefighters work extended 24-hour shifts, but trends are toward 48 96-hour shifts and, for the busy sites, 12-hour shifts. Little data are available about the lifestyles of firefighters and EMS responders, such as average hours worked, slept, and a second job. So what do we know about the effects of sleep deprivation on firefighters and EMS responders? We know that alertness decreases over 24 hours, and this has been found in other groups. There is no systematic data on crashes commuting, but deaths have been reported among firefighters and EMS responders. We also know that firefighter injury rates are highest during the early morning hours, twice the rate of mid-afternoon. You can see from this graph that injuries among firefighters are highest from midnight to 6 a.m., despite most fires are afternoon and early evening. So let's summarize. Sleep is important. Non-REM sleep for physical health and REM sleep for mental health. We also know that not getting enough sleep is harmful. It adversely affects performance, mental well-being, and physical health. Firefighters and EMS responders are susceptible to the effects of sleep deprivation and long work hours, and this has been demonstrated for other groups. So what can you do? Get more sleep.
So the simple answer to coping with sleep deprivation is to get more sleep. You cannot train yourself to need less sleep, and we are the worst judges of our own sleep deficit. It's easier to see sleepiness in others than yourself. We differ in our ability to tolerate sleep deficiency. There's no good test to know our own ability, and for reasons that we do not understand, even the same person can differ in his or her ability to tolerate sleep deprivation.
As Dr. Elliott stated, there is no good test or single objective measure of a person's ability to tolerate sleep loss. This slide shows individual variability on sleep deprivation. A person's ability to tolerate sleep deprivation can change from one week to the next. This was best observed among fighter pilots, and the study revealed that their ability to adapt to chronic sleep loss did not remain constant. This was despite controlling for identifiable factors such as diet, exercise, fitness level, and environmental stressors. So there is more to individual variability than we understand. Those with sleep disorders, such as untreated obstructive sleep apnea, have sleepiness as part of their illness. If your score on the Epworth Sleepiness Questionnaire was greater than 10, you are sleepier than normal. And if your score was greater than 16, you may have sleep apnea. In addition to being sleepy, untreated sleep apnea is associated with snoring, obesity, high blood pressure, sexual dysfunction, and sudden death.
I mentioned earlier that being sleepy is associated with car crashes, and untreated sleep apnea increases car crashes 12-fold. That's so concerning that all truckers must be screened for sleep apnea. A high score on the Epworth scale, any crashes, being overweight, high blood pressure, or a neck circumference of over 17 for a man is an indication for an overnight sleep study to look for sleep apnea.
So it can be a vicious cycle, because the more sleep deprived you are, the more likely you are to have sleep apnea. The good thing is sleep apnea can be treated, which will reverse the health problems associated with it, including daytime sleepiness. So what are countermeasures and coping strategies for sleep deprivation? It's important to identify at-risk workers. Secondly, what are strategies individuals can do? And third, what can work sites and workplaces do? It's important to identify individuals with obstructive sleep apnea, or OSA. OSA affects 2% of men and 1% of women. If you are sleepy, known to snore, overweight, and have high blood pressure, you may be at risk for OSA. Diagnosis requires 2 nights in a sleep laboratory, and if severe, is usually treated with nighttime positive pressure breathing apparatus. So, individual strategies: lead a healthy lifestyle. This includes exercise daily, eat 5 to 9 servings of fruits and vegetables per day, limit your dietary intake of saturated and trans fats, maintain a healthy body weight, no tobacco use, and get enough sleep. Regarding individual strategies to improve lifestyle behavior, the National Cancer Institute funded the FLAME study. This study followed 600 firefighters initially from Oregon and Southwest Washington to improve nutrition and exercise behaviors. The study is ongoing and now being disseminated nationally. To learn more about the FLAME program, contact www.flameprogram.com. Naps are important to reduce the effects of sleep deprivation or in anticipation of being up all night. If possible, brief naps less than 20 minutes or longer than 90 minutes to avoid sleep inertia. An interesting study was published in the Archives of Internal Medicine showing naps or siesta were associated with reduced coronary mortality in working men.
Grande red eye.
More than 90% of Americans drink coffee every day, and they average about 2 cups a day. What about stimulants like Provigil or modafinil?
Regarding stimulants, 2 to 3 cups of coffee can increase alertness, but the effects are not immediate. They vary among individuals and can last 4 to 5 hours. For most people, a prescription stimulant called modafinil or Provigil is no better than caffeine. And remember, alcohol is a depressant. While it may promote getting to sleep, it also disrupts sleep and makes snoring worse. Regarding commuting, driving home after a long shift is a particularly vulnerable time. If people plan to sleep after work, they may be advised to avoid stimulants such as caffeine, bright lights, and physical activity, which would make a long commute home after work even more risky. A short nap is advised before a long commute, and pull over if you are drowsy. Let's talk to a sleep expert from Oregon Health and Science University about naps and commuting.
Well, generally speaking, any sleep is better than no sleep. So if you can get sleep, and just a very short amount, try to take that opportunity and do sleep. A short nap, meaning a nap less than 30 minutes, has the advantage of you being able to come out of it much more quickly. So you take a short nap and you right away you're pretty much close to, you're ready to perform. The longer nap has a disadvantage of causing what we call as sleep inertia, which is the effect of drowsiness after you wake up from it, so getting adapted to your environment again. That's the downside of taking a longer nap compared to a shorter nap. What do you do when you go home after your shift? And as we know, this is the sort of peak risk period for having a fatal car crash or a near-miss car crash. So it's a very critical period of risk for most people that are shift workers. And one of the most effective strategies is to take a 20-minute nap just before you get in the car, and it will sort of, again, help you make it home if it's another half hour to an hour. Should be able to give you enough energy and alertness to make it home safely. Caffeine can also be used again, but oftentimes people already had multiple cups of coffee during the night, and it may not be quite as effective. And even more importantly, if you do drive home, if you do feel drowsy, don't keep going. Pull over and take a short nap then, even if it's just a few minutes from your home, because you may not make it.
So what are worksite mitigation strategies? The first thing to do is educate all workers about sleep and fatigue management. Secondly, change the physical environment. For alertness, you want bright lights, cool temperatures, exercise facilities. For sleeping, you want quiet, dark, privacy, and a quality mattress. Other worksite mitigation strategies include to structure work so tasks are accomplished when most alert, and adjust performance expectations for circumstances. Secondly, develop a culture of shared responsibility and monitor co-workers. You're not the best judge of how sleepy and fatigued you are. Third, if work hours are restructured, all company employees, including the workers, management, families, consultants, must share in the design.
We hope you took a few minutes to do the self-assessment questions before watching the DVD. We're going to go through the answers now.
All the answers are in this module called The Effects of Sleep Deprivation on Firefighters and EMS Responders.
Here's question 1. What are the names of the different stages of normal sleep? The correct response is B. Non-REM stages 1, 2, 3, and 4, and REM or dream sleep. Question 2, what causes a person to feel sleepy in the afternoon and after midnight but alert at other times of the day? That's your circadian rhythm.
Question 3A and B. Question 3A. If you lose 1 hour of sleep per night for 7 nights, it is equivalent to staying up all night for 24 hours. That is true. (3B) It only takes one good night's sleep to restore your entire sleep debt after a prolonged period of decreased sleep. That is false. (4) If a person wakes up feeling groggy, they may be experiencing sleep inertia. That's true.
How does alcohol affect sleep quality? This is question number 5. B. Alcohol worsens sleep quality. Question 6. Which is not true about drinking coffee? All are true except A. Coffee does not instantly increase your alertness.
Question 7. You are feeling tired after a long 24-hour shift, and you have a 45-minute commute home. What is your best option? A. Relax and drink a lot of coffee. B. Sit in a bright room and listen to loud music. C. Take a nap. Or D. Exercise. The best option here is C. Take a nap prior to driving home. Question 8. Chronic sleep deprivation is associated with adverse health effects. Which of the answers below is not associated with sleep deprivation? The answer is C. Peptic ulcer disease is not associated with sleep deprivation. Question 9. Fatigue is affected by which of the following? A. Hours slept. B. Circadian rhythm. C. Sleep disorders. And the answer is D. All of the above.
The last question is number 10. How can you identify someone at risk for sleep apnea? Circle all that apply. And A, B, and C are all true.
So we hope that you've come to appreciate how important healthy sleep is to our well-being. Sleep, or lack of it, impacts humans' psychological and physiological health. And adequate restorative sleep is needed to perform optimally and to be healthy.
As the IAFC president, Chief Harms, stated at the beginning of this report, firefighters and EMS responders are charged with the immediate care of our 24/7 society, which can require long work hours under emergency conditions until the job is done. This put members at risk for sleep deprivation, and a significant safety hazard is present when a person is sleep deprived.
The challenge for fire and EMS responders is to minimize the potential decrements in performance and the cumulative adverse health effects that come with long work hours and shift schedules. By implementing the mitigation strategies and countermeasures outlined in this DVD and written report, you can reduce the acute and chronic adverse effects of sleep deprivation. So, who needs sleep?
You need sleep.
I'm young, I'm strong, I can work hard all night long. I need some money in my pocket. You snooze, you lose, no time to pay your dues. I'm moving up just like a rocket. I can't waste no time in bed, 'cause I can sleep when I'm dead. I got big old fish to fry, so step aside as I